Hi everyone. Hannah, please wave so that I can see that you can hear me. I would like to thank everyone for joining us today in our webinar. Today's webinar forms part of the working that SWOP has been doing during the COVID-19 pandemic. My name is Mbuso Nkosi. I coordinate the team that has been producing work on the pandemic, and the work on this COVID-19 pandemic is now on display on the updated SWOP website. Before I even start to speak on the website, first I'd like to extend my appreciation to the work done by the team members who have been responsible in updating and also working on the COVID-19 work. So I'd like to extend my appreciation to Tasnim Iswap, who's also here, Nicholas, who's also here, Simon Gash, and Brittany. And so, our intention today, let me speak to the website first. We have made an update to the website, and this website, please visit it, and you will see that in our website, what we have done is to look at a number of factors that we think are quite critical during this moment. So we are looking at particular themes. So one of the themes is community health and work, food justice, environmental justice, violence, activist interventions, and more importantly, we also have a library that focuses on the scholarship during the pandemic. And in so doing, the intention of SWOP is to contribute to the collective understanding of this moment and the responses to its various problems and challenges. So if you visit the website, you will see that we have also posted interviews or podcasts with transcripts, and you can use them in various ways as long as you acknowledge the source. And we have done an interview with the Alexandra Community Healthcare Workers, an interview with Soli Malema, the national organizer of the National Union of Public Sector and Allied Workers, an interview with the People's Health Movement National Coordinator, Tinashe Njanji, and on the food justice, we have done an interview with the Indian campaigner, Deepa Singh. And recently, we have also uploaded an interview with the Gauteng MEC of Health, Dr Bandile Masu. And so, one of the important things that we have done with the website, we have added a feature that allows people to make comments. And the intention of this updated feature is to allow for interaction of what is posted on the website and also allow for collaboration. Towards this end, we have also partnered with the South African Labour Bulletin that publishes articles on this new updated website, which I edit. So please look at the articles that have also been published by the Labour Bulletin. I think the broader intention of the website is to generate discussion. That is why before each webinar, just like the one that we are having today, we post a blog or the author's reflection that you can read before, and you can make comments on the website even before coming to the web. So the reflection are posted in advance and the webinar follows. So the webinar forms part of the aim of creating the online library or an archive that forms part of the scholarship aspects that happens during this pandemic. So I hope you will enjoy Daniel Nkhata's presentation today, which is also streamed live on YouTube and Facebook. So this is recorded, and I'm just going to hand over to Hannah, who will introduce Daniel, and then we begin with our webinar. Once again, thank you. Please don't forget to make the comments on the websites.
Hi everyone, and thanks very much to Mbuso for introducing the wider set of events that SWOP has been doing and will be doing going forward. So I'm going to be just kind of chairing this webinar and want to begin just with a quick introduction. Just to say quickly, this is being streamed live on Facebook, but unfortunately the YouTube live streaming isn't working, but we trust those of you who want to be with us are here now. So yes, just a very warm welcome to Daniel, and thanks so much for joining us from Malawi. Daniel Nkhata is a researcher with the Catholic University in Malawi. He did his master's at Wits, supervised by Carl van Holt, who's also with us on this call, on bloodsucker violence and its relationship, in particular, from what I understand, to the extractive industry, but also the state more widely in Malawi. And he was actually set to give a breakfast seminar back in March before COVID hit, all of us everywhere in the world. And this in many ways has changed the exact set of questions he's going to be speaking to today. So the title of his talk is COVID Testing is Just Like Bloodsucking. And it will offer a kind of critical analysis of the rise of bloodsucker violence, as he refers to it, which there's been a rise in this kind of violence targeting COVID-19 frontline workers in Malawi. So he's going to be drawing upon his older, more extensive research, but really trying to draw upon that to make sense of this recent rise in violence targeting healthcare workers. And I just wanted to add to the introduction by saying, of great interest to me, and I'm sure many of you, is that I learned only recently that Daniel has training as a nurse prior to making a shift to sociology and a career in research and teaching. But because of his previous training in the kind of as a health professional, he was asked by the Malawian government to, I'm not sure if he was working or volunteering in a COVID quarantine center. So this piece really draws upon really first-hand experience of working in a quarantine center. And we are really excited to hear what you have to say. And just to reiterate, we ask that you would not wait until the Q&A to post your questions, but to really, as Daniel's talking, if certain questions come to mind, to put them in the Q&A box, which you should be able to see at the bottom of your screens. Daniel's going to talk for about 15 minutes. And then we're going to have about half an hour for a discussion. The way we're going to structure that is I'm going to feed in those questions into a kind of discussion with Daniel. So it won't be possible for you to speak those questions, but we really would like to encourage you to write those down as early on into the talk, because that means more questions we can feed into the debate. So it's over to you now, Daniel. Thank you so much.
Hi everyone, I think you can now hear me. Thank you for joining us, our viewers who are here. My name is Daniel once again. I think the introductions have been given already. I'll not go back to that, but I'm just happy to see that my supervisor, Car, has joined us here. I'm grateful for that, and many other colleagues I'm working with have also joined the talk. I'll be so brief. There's a paper that was uploaded. I'm sure you've read that paper. I'll speak to the paper, but also talk about other issues. As I said in the paper, that an extension of the work I did in 2018 for my MA project around issues of blood sucking, but also the violence that emerged out of it, and the several other dynamics that defined blood sucking at that point. And when I was asked to give a talk some few months ago, I was going to focus on that, but COVID changed most of the issues that I want to talk about, and I'll now refer a lot to my work on COVID-19, especially the violence that has now emerged again in the northern part of the country on frontline workers. Now, to start with, blood sucking historically has been with us in the country for a long time. So around 1968, we had rumors around blood sucking. People woke up in communities and spread these rumors that they had bloodsuckers visiting them in their communities. Then again, around 2000, the rumors re-emerged, and there was a lot of fear in communities across the country, especially in the urban areas. Then interestingly, in the cases, most of the cases of blood sucking and the rumors that were going around in 1968, in 2000, politicians were mostly implicated in those rumors. Politicians, traditional chiefs, and people in power in the communities. in 2009, we had a very interesting case of a person people deemed as Nachipanti, in English, someone who walks in underwear. So he terrorized lots of communities, especially in Blantyre, and killed some people. And he, after being arrested, he confessed to the police and in court that he was sucking blood and was being paid $140 for doing that by some business people and politicians. So it was a big case again around 2009. Now, my work is mostly around what happened between 2014 to 2018, where we also had these rumors coming back, but this time around, there was a lot of violence surrounding these rumors. It wasn't just rumors. This time around, a lot of people in communities, especially in Mulanje, Choro, and Zomba, these are districts in the southern part of the country, but also bordering Mozambique, especially Mulanje. Communities ganged up, mobilized, and started to hunt down people that were perceived to be bloodsuckers. So my work mostly in 2018 focused on the violence that emerged from these rumors. And I argued in my work in 2018 that we needed to understand not just the rumors and the rumors of bloodsuckers, but also what they meant to these communities. And I argued that mostly in 2018, communities in the southern part of Malawi understood bloodsuckers, but also the violence that emerged out of it, or the violence that they unleashed on suspects. These suspects mostly were journalists. BBC journalists were attacked. We had politicians being attacked, tourists, especially white tourists, being attacked. We had engineers working on some exploration work on Munanyi Mountain, also attacked. We had traditional chiefs being attacked. And my work focused on these victims and why they became victims, or they became suspects in these communities. So most people said in Mulanje that for journalism, they thought journalism was so sucking. That's the term they used. Journalism was so sucking that journalists used to go and suck or extract stories from poor people in communities and sold them. These were miseries of people in communities, and they sold them in their papers, on TV, in the media. And their presentation in the media was not what communities thought was happening on the ground. For politicians and security agents, they were also attacked, mostly the police and court officials in Mulanje, and people said these were also extractive in nature because they were sucking the little money that most poor people were making in those communities. So for example, police getting bribes from poor people that they shouldn't be arrested, but also terrorizing these communities when they were trying to control the protests that were happening. But one thing to also understand from 2018 is that Mulanje and Choro are districts that have got tea estates, and most of the people that got involved in this violence were workers from the tea estates. So my work was linked to issues of precarity, that young people are protesting precarity in those, they're protesting their conditions on those tea plantations, and that also translated to violence on white plantation managers. That also extended to tourists and other groups. While the area cases like in 2000, 1968, 2009, while we didn't have a lot of violence coming from communities, 2018 showed a lot of violence. So my focus on this transition from just rumor to violence that took place and why communities mobilized. So that's work I talked about. But recently, we have also had these rumors now, especially in December and January 2020, taking place in the northern part of the country. So we've moved from the southern part of the country, we've gone to the northern part of the country. And in those areas, this was before COVID, really the fear of COVID gripped communities. Violence meant, communities ganging up and literally killing, lynching, burning property of suspects, burning vehicles of suspects, burning houses of suspects, lynching them and beating, and the media was reporting all these issues. But I realized later on that actually these things have been happening in those communities, but it only became so dramatic when the media reported about it. So I've been arguing in my work that the proliferation of these complex forms of violence, especially in the northern part of the country, are also a reflection of how maybe violence has become a natural manifestation of how individuals are interrelating in our communities, but also how they're organizing themselves in societies. This violence only becomes dramatic when the media reports it. But for those communities, the people that are living in those communities, this sounds like something that is normal, something that is part of their now social order, as much as it also distracts some of the things. I mean, the social order in those communities. So my recent work now, based on COVID, is focusing on how frontline workers, if you follow the link in my paper, were attacked in the northern part, and these have been cases that have increased as much as haven't been reported. So I've been trying to understand the context in which these workers have been working, and what that violence means on these workers, and how it also reflects on how the government has managed or mismanaged the COVID issue in the country. So on that, one of my arguments that I've raised is that it's an issue of trust. Okay, it's an issue of trust. It's an issue of rumor and strangers. It's an issue of politicization of COVID-19, especially because the country, the time we started talking about COVID in the country, we're also moving towards elections. So we just voted on 23rd June, but the official campaign period started on 19th April, I think. But all along, we had court issues around elections that we had last year in 2019. So COVID hit us at a point when the environment was highly politicized. So the moment the government started to manage COVID, they couldn't run away from politics. In April, the government announced a lockdown, for example, that we're getting into a lockdown just like what happened in South Africa and other countries. But citizens went to the courts and took an injunction against that to stop the government. They had their own arguments as citizens, we had our own arguments. Interestingly, the moment we were opening the official campaign on 19th April, politicians broke every single lockdown or I mean, every single protocol around COVID management, no social distancing. They started to hold mass rallies, and people said, but you wanted to lock us down just a few weeks ago. Why are you breaking all these protocols? And that was a breakdown of trust. And rumors came out that the government was also mismanaging resources around COVID. Then in our country, we've got community health workers that work in these communities. But with COVID, those community health workers were overtaken by workers from I wouldn't call the central government, workers from the central administration or health management. So most of them may be coming from the headquarters or big hospitals, getting into communities. And these were strangers. But at the same time, we had strikes by health workers, frontline health workers, saying the government was not purchasing PPE for them. So they didn't have PPE, and there were strikes around that, but they're also arguing that they needed a risk allowance. But the government said, no, we don't have the funds. The funds that were allocated to them were not enough. Yet, rumors also came out that ministers or politicians involved in COVID management were receiving a lot of money and abusing a lot of resources. So when health workers were getting into these communities to do tracing and to do testing, it became a big issue. And the violence that was already there around bloodsuckers, which was not being reported now, got on these health workers. They started to be attacked under the pretext of being bloodsuckers, and most people said there's no difference between COVID testing, especially if you look at the process of getting fluids from the body and how people understand bloodsucking. and how health workers work. People like Louise White from anthropology, history, but also people like Adam Ashworth have written about these issues, saying they also reflect on how our communities, our rural communities, have actually come to understood or come to terms with modern health system management or modern health technologies, so issues of testing and other things. So that is also, my work also refers to that, but it goes beyond that because of the violence that was unleashed on these people. Then, secondly, if you look at South Africa, our friends had a militarized COVID management, where the military was on the streets managing all these issues. For us, we had the police getting into these communities now, escorting health workers. So there was a lot of policing of testing, policing of tracing, which became a big issue with communities because already the police do not, police have a fractious relationship with communities. So health workers were actually exposed along the way because they came representing the government on the ground, a government which was not trusted, but also they came in an environment that was heavily politicized, very volatile, but also they came at a time when communities were battling with all these rumors of bloodsuckers. Number three, I've argued that violence around health workers is also a reflection of retributive justice, but also a proliferation of complex forms of violence in our communities. So, because the police have mismanaged or have mishandled most of the cases around bloodsuckers, they didn't trust communities about the existence of bloodsuckers. When issues started to happen or violence started to happen on health workers, things began to get into the media and people said, we'll continue. Actually, cases grew in numbers because now people thought it was them against the police, but health workers were in the line of that. We had a case, number four, a case where I'm talking about smoke that cause, that communities also used this violence to actually invite politicians to visit their communities because some of the communities had existing issues which were not being addressed. So for example, a pregnant woman who dies along the way going to the hospital because there's no clinic in her community, people have been crying about it, no one came to attend to it. Within this period, this violence was used to actually send a message and politicians were going into those communities to address those issues. So to some extent, this violence was also used by communities to destructure some orders, especially around policing, but also around how we've managed our affairs in these communities. I'm not saying I'm celebrating violence in this case, but to some extent, you can actually tell that this violence actually meant the structuring of some social orders in our communities by our people, especially fighting the police, fighting politicians, and other stakeholders involved. So finally, I would also want to say that violence should also be understood from this element, as much as it is a structural problem that shapes social order, both at individual and collective levels. It has also destabilized some orders in these communities. And these are issues which maybe later on my work could also get into and get into details. So what I've done here is to actually extend the work that I did in Mulanje and try to understand what has been happening in the northern part of the country, especially because of COVID-19 and how communities have unleashed violence on frontline workers. I think because of time, let me stop there. I should tackle other issues as people ask questions. I see questions already coming. Thank you so much.
Great. Thanks very much, Daniel. I'm assuming Taz will put my screen back on. Here we go. Yeah, thank you so much. Just to say, I've asked Taz actually to put the link to the article that Daniel wrote, which is on the website, which goes into some details around COVID in Malawi and some of the more specific details around these instances of violence that healthcare workers were the victims of. So what we're going to do now is I have a few remarks, and then we're going to open up for a set of questions. So we've had 2 questions come in, and I'm going to weave one of those immediately into my initial remarks, and then I will just kind of keep feeding them in. So please do have a look at the article Daniel's written, and continue to bring your questions in. We'd like to involve as many of you as possible. So Carl van Holt asked a question, and his question was, can you tell us a little bit more about the history of people rejecting Western medicine as bloodsucking in Africa and the reasons for this? And I guess that ties into one of the comments I wanted to make is, Daniel, you mentioned Louise White's work, who I don't know it very well, also Adam Ashforth, but there's this long history that throughout the colonial period, kind of people across the African continent kind of told stories that involved bloodsucking in some kind or another to, as I understand it, kind of describe and understand colonial power, which was about the extraction of resources or dispossession in various forms. And in Louise White's work, she talks about people who, there were these rumors that if you worked for a white colonist, they would kind of capture you and literally suck your blood. And then, as Carl is kind of pointing to, there's also this long history of concerns around kind of Western medicine. And we saw this with the HIV epidemic and the Ebola epidemic, that medical practitioners and researchers are often suspected of being kind of blood thieves. And so what I found interesting was that you started your talk with a bit of this history. You said, all the way just after Malawi's independence, 1968, there were these rumors of bloodsucking, and then again we saw this emerge in the 2000s. But if I understood you correctly, you said like one of the things that's changed is that these rumors around bloodsucking and extraction and sucking, as you call it, have existed for a long time. But one of them, a newer phenomenon, is that these rumors actually now legitimate or are the basis of forms of what I think in some of your work you refer to as kind of vigilante violence, or forms of also forms of kind of violent protest, as you refer to them. So I thought it would be helpful to, one, clarify, is that what you're saying? But then the wider question is really kind of Carl's, which is, how do we make sense of these attacks on frontline workers, given this longer history of bloodsucker violence, but in particular, as Carl asks, this history of people rejecting Western medicine because it's viewed as bloodsucking. So I'll leave it there. We'd love to hear your thoughts, and then we'll come back to the other questions.
Okay, thank you, Ka, for that question, and thank you, Hannah, for those remarks. How do we understand these histories? I mean, how do we understand these attacks, especially on frontline workers today, reflecting on how historically our people African people have actually rejected Western medicine, or have understood Western medicine? I would say, as much as that is a reality in the work of Louise and some other anthropological work, we should also understand that for these communities, this is not the first time they're getting in touch with Western medicine and these modern technologies. So these are people that have actually been immunized. They've got community workers who are doing immunization programs in these rural areas. These are people that have got clinics. They're in touch with clinics, as much as these clinics are very far from them. So they're not strangers to the concept of Western medicine. But maybe the issue is, how do we understand this violence? How do we understand these attacks? And my work now is talking about the context in which these attacks are happening. Because most of these frontline workers are being attacked under the pretext of being bloodsuckers. And as I said earlier on, this is not the beginning. These attacks have not started on these health workers, but people have shifted from the other attacks that were happening because in Mzimba, people already, these rumors were already there and violence was happening, but there's been a huge shift from what was there already to frontline workers. So this shift of violence on bloodsuckers to now bloodsuckers becoming frontline workers is something that I'm also trying to explain, that these health workers are coming at a point when communities already have issues. These health workers are coming as representatives of the state. They are coming, I would call them in the crossfire between communities and the state, and they are coming as representatives of the state. As much as people also have got suspicion in terms of how health workers are managing these cases, issues of, so for example, we've got some communities where people are tested today, they're told they're positive, the following day you hear that person is negative. Okay, or people say I was tested, especially the people that were coming from South Africa, the deportees would say, we're tested at the border at Bedbridge when coming, we're negative. Then they arrive in the country, they get into these communities, they're traced, they're tested, they become positive. And these people are saying, no, this is a fabrication. This is a fabrication. And this fabrication is linked to suspicion on how the government is functioning and what the government is doing with COVID, the volatile space of politics and the elections we've had, but also the work of the police in those communities.
Great. I mean, I think actually that offers a really nice way to bring in this second, well, actually it was the first question. So about this kind of volatile political context. I mean, I only this morning did a little bit of my own research to learn that, you know, it was just on Tuesday that Malawi went to the polls for the second time in like nearly a year, and that the opposition leader, Dr. Lazarus Chakwera, apologies if I got that wrong, you know, has won the election with a 60% lead. So as you said, you know, this the pandemic kind of erupted on the scene at the same time you were entering really kind of a political contestation around these elections. And so I was wondering, in the context of that wider political landscape, but also that you were describing in your response to the first question that one way to understand these attacks on healthcare workers is that they are viewed as representatives of the state, you know, which makes me think about, you know, Carl's work and others around how often municipal buildings or libraries in some of South Africa's protests are viewed as sites of the state, which then become caught up in forms of protests and certain kinds of violence. But so if we think about this wider landscape that you're saying these attacks are happening in, then I wanted to ask how you then would respond to Marina's question. She asks, I think you can probably see it, but for everyone who can't, she asks, are you trying to put the blame on the media, i.e. journalists, for making things worse by bringing the blood-sucking stories to the limelight? Are they not just doing their job? So I assume this is going back to the very early point you said around how journalists are often accused of sucking, you know, of taking stories from poor people. But I'm assuming in the context of political contestation, some of those stories are about, get used in political contestation around the election. So I'm wondering if you can comment on specifically that question, but maybe also give us a sense of how this violence is interacting with this political volatility you talk about. Thanks.
Thank you, Hannah, for that, and thank you, Marina, for the question. I'll take you back to, there's a paper which was written by Albert Shara on journalism and how, I mean, using the framing theory and how journalists actually frame, they've got frames which they create through which they write their stories. And one of the stories is this issue of bloodsuckers. So, for example, there's a particular frame that our journalists have used to talk about bloodsuckers. So, for example, they've literally dismissed the existence of bloodsuckers. They've dismissed the rumors, and they've mostly said this is a reflection of rural irrationality. This is a reflection of primitiveness. This is a reflection of poverty and inequality in our context. This is a reflection of people who don't understand modern technology, especially when communities attack journalists and their gadgets, these modern gadgets. And you also see stories on BBC that are also referring to that. So these are frames which journalists have used, or the media has used, to actually show what this bloodsucker issue is in our communities, which they don't agree with. Communities don't agree with, because for them, they've got serious issues, real issues, which to them are life-threatening issues, as Ashworth says, and they have their own way of dealing with them. And these communities actually believe that bloodsuckers exist. Okay, they actually believe that bloodsuckers exist. We've had histories, for example, the case I gave about 2009, that there was actually a person who confessed to have been involved in bloodsucking. So I wouldn't say it is just a blame, but it is also a true reflection of how framing of news has happened by our media, whether it's political or other news, but in this case, the issue of bloodsucking, and how the media has portrayed rural communities, and how these rural communities have actually also attacked the media on the same.
Thanks very much for that. And thanks also for those of you who are posting your questions. We see them. And I think now we're going to have to maybe try and begin gathering a few questions. I'm going to take them in the order that they came, because I think they can build upon each other. So Carl's asked another question. So normally we would want new voices, but I think he asks a question which would be helpful to hear first. Carl's question is, how do the communities in which you're working in, or where the quarantine center was, how do they see the current pandemic? You know, do they accept the diagnosis of Western medicine, or do they see it as an element in the spiritual world, i.e. supernatural magic? And what would be its causes? And I also think, you know, in reading your piece and thinking about your experience, I wondered if you could give us even a sense of your actual experience in the quarantine center. What is the discussion like on the ground, in a way? How are people making sense of this disease, this virus, you know, where it comes from, what it means? So your thoughts on that, thanks.
Okay, thank you so much. I think firstly, I want to comment on the quarantine work. This is really underground for now, but I'll refer to the data collected from that, and remain anonymous. Remain anonymous, but I'll speak to the data, and the data that I have gathered, but also I've gathered directly, but also through colleagues who are working there, not myself. So communities and how they've rejected or accepted the results is a question that also goes beyond people being given the results that you're positive or negative. Results, testing is being done in a context, but also results are being given back in a context. And this context keeps on changing. It's not constant. So for example, it depends with the community you are from and the time that it has happened. So there was a time when people were so afraid of COVID in this country, and now we are living in a time when people don't care about COVID, literally. Okay, people literally don't care about what is happening around COVID. Their major focus was on, let us vote this government out and move on. That was the main focus of that particular period. And everything that the government said, because there was a task force created that was managing COVID, and we also had health professionals in that task force. At first, the chairperson was a politician. Then when the government realized people were not in acceptance of what was happening, they had a medical doctor, a professor from College of Medicine who co-headed that task force. But all this did not change the perception of people around issues of results. So you go to some communities, people accept that COVID is real, but they've been so selective in terms of the messages that it can get and the behaviors they can change. So you visit most communities, people are washing their hands, accepting messages on hygiene, but people also say COVID is political at the same time, but yet they're washing their hands. In terms of results, we've had the results where we've had a person being given the results today, and tomorrow a politician from the same community says no, an opposition politician saying no, that is false. They tested the wrong person, they've given the results of the wrong person. You see, so there's been a space, there's a space that has defined testing, tracing, and result management. As much as from the perspective of health workers, COVID is real and cases are increasing. And for them, they're being constant, they're being consistent in how they're doing their work. These are health professionals. But from the community side, these perceptions are changing in terms of legitimacy of COVID, but also how the news is being delivered, how the government is managing it. And now it's what we're seeing in for example, Mzimba and Rumpi, communities attacking frontline workers.
Right. Thanks, Daniel. I think we should take Martin's question before Daneo's. So Martin asks, I think it follows exactly where you were going and links to your earlier points about the fact that the government on the one hand is asking people to stay home, but then is also hosting government rallies. And the other point you made around how the mismanagement of government funds for the COVID response has again been politicized. So, but if you have more to elaborate on, I think we would all be very interested. Martin's question, for those of you who can't see it, was, do you think that the politicizing of COVID-19 is a specifically African syndrome or phenomenon? Yeah, Daniel, please.
Thanks. Thank you, Martin, for the question. Politicizing of COVID-19 management as an African syndrome. I don't want to speculate. We've had cases in Tanzania where the state rejected that there's COVID, later on changed, accepted there was COVID. Now they've just declared, the president just declared they're COVID-free. President Magufuli, but they still have a lot of cases there. Health workers are saying we still have cases, but politicians are saying this is a COVID-free country. And most of our cases in Malawi have come from either Tanzania or South Africa. Okay. Then coming back to us should be, I think, I can only use our case in the country as a good example. That the way the government has managed COVID-19 has also been defined by politics on the ground, especially because we've been in a context where the government needed to look legitimate, needed to sound legitimate, but at the same time, they also needed the resources to campaign because people were voting on 23rd June. At the same time, they need to go out and campaign in the communities. So telling people that there would be a lockdown in 7 days, then the same government beginning to actually conduct mass rallies for campaigning 2 weeks later is actually a clear indication that the earlier statement about lockdown was just a fallacy, and people have said no. Our government has actually used COVID to continue mobilizing resources from donors, so they'll do anything to increase the number of infections so that we've got more money coming in so that they can do campaigns and what have you. One of two ministers were caught on camera discussing about allowances, fuel allowance and the money that was supposed to be paid for the traveling around COVID supervision. They were visiting, supervising quarantine centers and borders. So all those issues can show that to some extent politics has been involved. But we should understand this politics differently from how our friends from the Ministry of Health have been managing these cases. To them, there's no politics. They've been consistent with their messages. But communities and politicians have got a different discussion going on.
Right. Thanks, Daniel. I think it is worthwhile just to note Carl, who asked the question, his comment, which I would agree with. You know, he said Trump is politicizing COVID-19. So is Bolsonaro in Brazil, and this is clearly not an African theme, and I think that's evident all over the place. So I think we've got a few minutes left, and I think we'll end with Daneo's question. Her question was, do you see bloodsucking as, amongst other things, a process of othering? And I just wondered also, in your article, something that interested me is you wrote, and again, I suggest others would be great if people could read the article, and we can continue this conversation on the website. You said that you suggest that the recent cases of vigilantism that target strangers and outsiders, so not just healthcare workers, reflects, and these are your words, the increasing nature of suspicion towards outsiders. You use this word outsiders in rural communities, but you also showed in the article that a lot of you know, when the numbers were increasing in terms of who was getting COVID-19, many of them were coming from migrants returning from South Africa back to Malawi. So I just thought it would be interesting to learn a bit about that, because it connects directly where many of us are. But then to really think about Daneo's question in relation to othering, and then we'll wrap up. Thanks.
Can you come back on othering? On Daneo's question?
So Daneo's question is just a big question. It's do you see bloodsucking as, amongst other things, a process of othering? How does bloodsucking interact with othering as a process?
Okay. Thank you, Daneo, for the question. I would say, to some extent, yes. We could also look at bloodsucking in that from those lanes, because most of the cases that we've had, if you look at the cases I've referred to in my area work, for example, in Mulanje in 2018, you could tell that this process was taking place because you had white journalists coming in, we had reporters coming from the city, or journalists coming from the city getting into rural communities, being attacked. We had engineers coming from working for white-owned oil companies, but others were consultants on the Blantyre Mulanje tapping water project, Mulanje Mountain water tapping project, also being attacked. But beyond that, we also had cases internally, where young people just decided to actually extend vigilantism to other community members. And in my thesis, I raised a very interesting issue that this was very gendered, because in almost every case of a suspected bloodsucker, the whistleblower was a woman. So females have been whistleblowing that I have seen a bloodsucker, or there is a bloodsucker, but they don't get involved in the killing and in the violence. So violence is an issue that gets into the hands of these vigilant young people who get into communities, burn down houses and kill suspects. And they've also taken advantage of the same space to actually, the same space of legitimate concerns from communities. They've also taken advantage of that space to actually meet their own interests. So for example, in Mulanje, the youth, unemployed young people, when the rumors of bloodsucking were going around communities, chiefs mobilized communities to actually pay these young people to do community policing at night, to police the community at night. Young people realized, I think this was lucrative, and they started to extend false rumors of bloodsucking so that they continue to be on the payroll of the community. So these are other interests getting into the space of blood sucking. But I agree with Dinayo that, yeah, we also look at this as a process of othering, especially if you see the number of strangers being attacked. If you check newspapers online, you realize that most people being attacked are coming from outside, not just outside the country, but outside the communities that are attacking them.
Great, thank you so much, Daniel. I mean, I can tell you I still have many questions to ask, but I think we're going to try and keep to the time deadline. So really what's left to say is a few things. The one is, again, to direct you to the article on the website and to really make that a space to continue the conversation. We'll make it possible, hopefully, for Daniel to be able to also interact with those questions. And yeah, just to then thank Daniel so much for his time, for writing the piece for the website, and making his time available today to be with us. And then to thank everyone who's been able to attend for your questions and participation. We are still trying to decide about making the best decision about format. So do send us feedback if you think it would be better to have participants interacting in different ways with video or not. We're still working out what we think will work best. And just to end with two announcements, that our next SWOP webinar will be on the 17th of July by Hlengiwe Ndlovu. She's going to be looking at kind of education and inequality in the South African context in relation to COVID-19. But we are also, before the 17th, on the 1st of July, which is next week, we're co-hosting a webinar with the History Workshop at WITS, and Dr. Laura Phillips, who was a SWOP fellow, I think a year or so ago. She's going to be giving a talk on mining in Laboa, the prehistory of the platinum boom. So please join us both on the 1st of July and on the 17th. And yeah, thanks very much. Thanks, Daniel.